Well, good afternoon. We're blessed in Ontario to have some of the most dedicated, hardest working people out there. And during this time, through this incredible challenge, our workers have stepped up. And while I'm on the topic of the hardest workers, I have to give a shout out to all the moms. Every day, despite everything you're dealing with, you find a way to make it all work. You're keeping the kids safe and healthy while homeschooling and keeping up with tasks around the house. And for many of you, balancing a full day of work on top of all of that. And you do it with care and love. I want you to know that your sacrifices during this time have not gone unnoticed. So, to all the incredible moms out there, you're the real heroes. Thank you. And no matter what you do, no matter where you live, we have your back. And it all starts with investing in our people. It starts with helping workers with training and retraining, upgrading skills, and preparing them for the new normal. And as more construction gets going, we're making sure our skilled tradespeople are set up for success, making sure they have the tools they need. So this summer, we're launching the all-new Ontario Tools Grant Program, a program that will help up to 11,600 apprentices get a head start on their careers in skilled trades. And for those apprentices who benefited from our Loans for Tools program, we're forgiving over $10 million in loans. This represents about $500 back in the pockets of 19,000 apprentices for new tools, equipment, clothing, and manuals. By investing in our people, we're building a strong foundation for Ontario's long-term economic recovery. And I know many other sectors have felt the economic impact of COVID-19. Many workers in our tourism and hospitality sectors have been among the hardest hit by the global pandemic. And we're doing everything we can to help. Through the Unite Here Local 75, we're investing almost $2 million to create a virtual action center to help impacted workers upgrade their skills as we gradually and safely reopen the economy. This skills training will ensure these people can get back to work with the skills and know-how to help businesses adapt to the new environment. Before I pass it along to Minister McNaughton, I just want to send out a big thank you to our construction sector. Monte showed me a letter from the folks at the Building Trades Council and Elliott. All of us, government, labor, and industry, are working together to put the health and safety of every Ontario worker first. Together, we will ensure that every sector in this province can thrive and come back stronger than ever before. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister McNaughton.
Well, thank you very much, Premier, and good afternoon. Things are still tough for a lot of people in our province now. The hospitality sector has been particularly hit very hard. Unite Here Local 75, which represents workers in the sector, tell us that 90% of their members have been laid off. And that's why we have to step in and act. Today, we're investing in a new virtual action center, an online retraining portal that will make life a little bit easier for them by connecting them with opportunities for counseling, retraining, and jobs. These opportunities will help on our road to recovery. We're standing up to help others too. If you owed money from our Loans for Tools program, you're not going to owe that money anymore. And for all the women and men entering the trades, we're creating a new tools grant to help you get started. Premier Ford and our government want to give you a leg up as you're starting your careers, especially during these very difficult times. We've been there, we get it. COVID-19 has created a new class of heroes. Electricians, iron workers, drywallers, and so many others serve this province as essential workers, just like doctors and nurses continue to do. As the Premier mentioned, the construction industry has stepped up. Today, I got a letter telling me that thanks to our hard work together, there were a very small number of cases of infection in the sector, and that's something worth celebrating. The point here is very simple. We all work well when we work together, business, labor, and government. So thanks to the insulators, the boilermakers, the laborers, the carpenters, the form workers, the painters, the plumbers, the good people of this province who have stepped up to get us to where we are today. You've stepped up, and I want to thank you for that. Thank you.
We'll go to the phone line for questions. First question.
First question comes from Alex Bloomfield from 680 News. Please go ahead.
Hey, good morning, Premier. Testing this question likely for you, perhaps the health minister. In light of the federal government's announcement this morning on contact tracing and testing aid for provinces, what do you see this changing on the ground here in Ontario? What are the hurdles perhaps standing in the way of rolling out a program like you mentioned in passing yesterday, random testing in the community? Does today's aid help take those hurdles down and make this happen faster?
Well, I had that conversation with the other premiers, with the Prime Minister and Deputy Prime Minister on our weekly conference call. And it's so important to have the proper app, making sure that we do contact tracing and tracking. And another thing that's really important, Alex, is when we fully reopen the economy and people are flying from, let's say, Vancouver to Toronto or Calgary or out east to Halifax, those apps have to be able to talk to each other. And it seems like every province has their special kind of homemade app that they really enjoy using, but it's so critical that we communicate to each other. And we've all agreed, all the provinces and the federal government has agreed to put a table together, a table with all our technology experts until we can make sure this works forward. But you know, this is absolutely critical that we continue tracing and tracking. I'll pass it over to the Minister of Health. Thank you.
Well, it is really important that we continue to do the tracing and the testing, and we need to look not just at Ontario, but the entire country, because people will move around more as the economy opens up. So we want to make sure that we can have the capacity to work together. As the Premier said, the systems all have to work together so that we can react as a country. But we are going to make sure that we continue with our testing here as well. And then our contact tracing, we are able to right now test over, do the contact tracing within 24 hours of 92% of the cases that are coming before us. We're still trying to increase that number, but we're doing very well. But again, having that the app that can speak to these issues and can connect all the provinces together is vitally important for us to make sure that we beat COVID-19.
Follow up.
This question may be for you, Premier, perhaps the Minister of Labor as well, but this is obviously an important weekend for Muslims. I'm wondering if you have any update on future directives for mosques, churches, synagogues. We haven't heard too much on this lately besides the drive-in service exemption earlier this week, which isn't feasible for a lot of congregations. I know you've been involved in a few consultations with some faith leaders in recent weeks, but I think a lot of pastors, imams, rabbis, they would appreciate clarity that you could give them today, or any clarity you could give them on a timeline for possibility of restricted in-person gatherings. Would that be part of stage 2, for example? Maybe even guidelines that might come, I guess, from the Labor Minister's office. We've seen some of those for other sectors, but not yet for places of worship. Any update on that? Well,
first of all, for the Muslim community, I want to say happy Eid Mubarak. They've been an incredible community that have been donating so much to communities, and not just their own community, by the way. I want to emphasize that. I've been at a couple of their food drives, handing out meals, and we're very, very grateful. We're going to go back to the golden rule. You have to stay 6 meters apart. It's absolutely critical. No matter what area you're from, just continue practicing social distancing. It's absolutely critical. And the food drives that I've been at, everyone's wearing a mask, which is great. Continue to use face coverings. It's absolutely critical. But nothing has changed. Just keep social distancing, and please practice the protocols that the Chief Medical Officer has put out there.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Hi, Premier.
Hi,
I wanted
Lucas.
to get your reaction to something that was in the National Post. Four infectious disease specialists from the U of T and McMaster wrote an op-ed, and while they say you need manageable hospital capacity, the ban on mass gatherings, physical distancing, etc., the reopening of the economy should not be dependent on consistent lower cases, but that, of course, is a big plank to your economic reopening framework, that you need to see consistent decreases in that in order to continue on in the stages. So I'm curious, how do you feel that a number of experts are coming out publicly against this position of yours and to lift restrictions?
Well, I just want to, first of all, I didn't read the article, so it'd be tough to comment on that, but I'll tell you, it's not about me. It's about our health table. And we have some of the brightest minds on that health table in the country. I'll put them up against anyone. We have a great public health system here in Ontario. So again, I got to follow the advice of the chief medical officer, our health table, and science. That's what I'm sticking with. I'm not moving from health and science, and I'm going to read that article and I'm going to bounce it off the health table and get their opinion on it. But again, I'm going to stick with the advice of the chief medical officer of health and the health experts.
And that being said, Premier, do you think you need to change your messaging a little bit? I know that Dr. David Williams got a bit of reaction yesterday when he put the question out there. Is some of our messaging not clear? Is some of our messaging confusing, especially when you have, hospitalizations, ICU, ventilators? Those got some good news on those today, but the number of cases going up. So I'm just curious if you feel you need to improve your messaging a little bit. And if I could sneak this one in as well, why not test kids and students for schools and daycares and just staff, as you mentioned yesterday? Can you explain that as well?
Well, first of all, I think our messaging has been pretty consistent, following the protocols of the chief medical officer. When possible, do the self-isolating, keep the 2 meter distance. And that's been our message, and we aren't getting off that message. So, and as for the kids, I'm going to pass that over to the Minister of Health.
Well, that is a very important question, and I can tell you that in a couple of situations in the daycare centers where there was a staff member that had COVID-19, that permission was asked of the children's parents for the children to be tested, and they were tested. You have to have a special nurse or practitioner to be able to conduct those tests, because in small children it's very delicate with the nasal swabs that have to be administered. But that is something that we will continue to do if we see an outbreak. But of course, it's really important that you get the parents' permission first of all, and that is something that we worked on with the Ministry of Education, and that happened. But you're right, the situation with children is very important. The response for children may be somewhat different. We've seen the symptoms that may look like Kawasaki syndrome that we are looking out for. So we want to make sure that as we open up the economy, we are making sure that we do testing in all of the right areas, and further testing of children will be required. But of course, parental permission needs to be obtained first.
Next question.
Next question comes from Ryan Roca from Global News. Please go ahead.
Hi there, Premier.
Hi, Ryan.
Your government has put restrictions on short-term rentals during the pandemic as part of the emergency orders. Will that be changing anytime soon? Will people be able to rent vacation properties now that we're heading into summer?
Well, we're going to have to look at stage 2 or stage 3 even, and I'll be able to get back to you on an answer. I just can't answer that right now. We aren't there yet, and we'll find out over the next little while. I know some people are pushing for it, but again, we'll get that answer for you.
If the rules then aren't possibly going to change anytime soon, is the government considering any measures to assist property owners who rely on these vacation rentals as their main source of income?
Well, I can't say that right now. Again, we're going to have to see how the numbers go over the next couple of weeks, and hopefully the numbers will be going down, and we'll be able to open that up.
Next question.
Next question comes from Lisa Shin from CBC News. Please go ahead.
Hi there, Premier.
Hi.
First question I'd like to ask you is not specific to COVID-19, but is in the news today. CBC has been trying to get copies of your mandate letters to cabinet ministers for nearly 2 years since you were elected, and now your government is fighting it in court. Throughout the pandemic, you've touted how transparent your government has been during COVID-19. So why are you spending tax dollars going to court to keep those mandate letters to cabinet ministers secret from the public?
Well, that's in front of the courts, and the courts have to make a decision. And anything in front of the courts, I can't answer. No other elected official can answer while it's in front of the courts.
Follow up.
Thanks. And my next question is for Health Minister Elliott. You've announced hospitals can start to resume scheduled surgeries, but we're hearing a lot of hospitals actually aren't allowed to, either because they don't have the required 30-day supply of PPE on hand or because their occupancy rates are too high. So what exactly is the province going to do to help these hospitals get more PPE so they can open up more beds?
Well, there are a number of issues that need to be answered by each individual hospital before they're able to resume scheduled procedures. They are preparing their readiness assessments now and submitting them on a regional basis for approval. There are a number of factors that come into play here. One is the number of people that they already have deployed. If it's a hospital that is deploying people to long-term care, they need to make sure that they have 15% additional capacity in case there's a surge in COVID cases. There's the availability of surgical drugs. PPE is part of it, absolutely. There are a number of things that have to be answered. So we are waiting to receive the responses that are now being reviewed on a regional basis in many parts of the province. And we do have the assistance. We are supplying PPE to hospitals, but of course, if they're going to do the scheduled procedures, they will need to have their own supply and not tap into the pandemic supply. So we are supplying them regularly with what they need for pandemic purposes, but they also have their own supplies with their own suppliers. So we expect that they will be able to continue to do that, and we are able to assist them if they need any help in securing them, if they need any contact leads. So it is a more complicated process than it would first seem, that we want to get moving with elected or scheduled procedures. We have over several thousand behind in that. I know that for people that are waiting cancer surgery, for example, or heart surgery, any kind of surgery, it's an extremely difficult time for them. But we want to start those procedures as soon as possible. And as soon as the regional plans are approved, they will come directly to us and we will get moving with them. Thank you.
Next question.
Next question comes from Faiza Amin from City News. Please go ahead.
Good afternoon, Premier and
Good afternoon.
Ministers. I wanted to ask you a little bit about ODSP recipients. Prior to COVID, they were already concerned that the rates were well below the poverty line and people were already struggling then. The federal government is providing about $2,000 under the STIRB program compared to the $1,169 under ODSP. And so if these people apply for STIRB, there's a good chance that their rent will increase. So why hasn't there been an increase in rates for ODSP recipients? And what do you say to those who are struggling financially even more during this pandemic?
Well, it's very tough. I've talked to many people on ODSP, and we appreciate the offer the federal government has given. We also have a program that if people are working, like let's say 10 hours or 15 hours a week, they aren't going to be punished. Actually, they'll get 50% of the SERB, I believe, and help them out that way as well. But it's a tough time for everyone, and it's very tough for people on ODSP as well, along with so many other people. So we have an eye on that, and we're going to help them any way we can.
I wanted to also ask about contact tracing. We've seen Alberta implementing a voluntary app for this purpose. Is Ontario considering doing the same? Can you explain a little bit what system is in place for contact tracing and how many cases you're able to track back to the source?
Well, before I hand it over to the minister, I just want to give you some stats. Between the Ministry of Health and Public Health, along with the federal government, we have over 2,000 contact tracers. out there on a daily basis, being able to trace and track the people. And as for Alberta, the uplift is about 11%. I was talking to Premier Kenny yesterday. It's just getting people on board to utilize it. And even in let's use Singapore, for example, because that came up in the conversation yesterday, and they have a pretty regimented system. And even over in Singapore, the maximum they've been able to get is about 25% of the people to go online. Privacy is very, very important, and any app that doesn't have a privacy area in it, then that's going to be difficult. People believe in privacy. I believe in privacy. So we have to have the right app, and I'll pass this over to the Minister of Health.
We are actively looking for the right app for Ontario right now for management of COVID-19, to indicate to people that if they've been in contact with someone with COVID, that gives them the ability to then follow up with their own health provider. But in terms of contact management, generally, we have had hundreds of people come forward to help public health with contact tracing. Medical students, others have come forward to do that. And we are very, very confident that we are reaching over 92% of the people with contact tracing within 24 hours. Is there room to do better? Absolutely. We're continuing to work on that. But we are doing active contact tracing right now manually, but there are other technological aids, of course, that we can use, and we are looking for the right app, but one, of course, that's going to work with the rest of the country.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
I wanted to ask you more about what the Prime Minister announced this morning, and he did say that federal employees are now helping out in Ontario. So what exactly did you ask for help to do in Ontario? And given the challenges we've had with testing in this province, should this have happened sooner?
Well, we've already had help from the federal government. They're offering more help in the way of paying for the testing and the swabs and the reagents. We appreciate that. I believe they sent over 224 tracers, I believe, about a week ago. So all the help is appreciated, but we'll take as much as we can get right now, because it's absolutely critical, and we're going to continue focusing on tracing and tracking these cases. But the whole country's on it right now, and we had a good conversation with the Prime Minister and the premiers yesterday. We've put together a committee to make sure that we work through this and have an app that can communicate to each other within each province.
And you've said a few times now that you won't hesitate to shut down the economy again or scale things back if the numbers don't improve in Ontario. Yeah. I'm curious about how concerned are you that the public will just tune you out now? The weather is improving, things have begun to reopen, members of your caucus are pushing for expanded patios. So can you put the genie back in the bottle once people have gotten a bit of freedom? How could you scale things back?
Well, I have all the confidence in the world, and the 14.5 million people, we're here in this position right now because of all the great work that the people listen to the chief medical officer and the protocols. So I'm so grateful for everyone listening and businesses stepping up to the plate. And it's just been a real team effort, Team Ontario effort, and they're amazing. So let's see where we go on this. I think of it 24/7, and we're seeing some peaks and valleys, but hopefully we're going to see the trend go down, because I know the last few days it's gone up, and it's concerning. These are things that you're up all night thinking about. It's tough.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Good afternoon, Premier.
Hi, Sean.
The health unit in Windsor has announced today that it's going to start random COVID testing in that community with almost a spot check type model, where the paramedics go out, they set up in a public place like a parking lot, and they just start testing people for COVID who want to be tested and have their health information with them. I'm wondering your reaction to this plan. Is it something you support, and do you think it would be feasible to roll it out across Ontario?
Yeah, well, we're going to be rolling it out across Ontario. I'll just tell you the directive that the chief medical officer has sent out for this weekend, that we're going into the seniors' homes, testing the seniors. We're testing all the staff there. We're going back into long-term care. We're checking with the staffs and the residents as well. There's one thing to test once, but we have to continue testing. We're going into the frontline healthcare workers, and we're going to test the asymptomatic and symptomatic people there. So it's just ongoing testing. I said we're going to ramp it up. We're going to ramp it up. Then we're going to go into communities where there's, as I say, the hot spots, and it's really the urban centers around Toronto that we've seen. But I congratulate the people. The more testing, the better. So way to go, Windsor, and the public health unit out there. You're doing a great job. Keep going. We're going to expand this right across the province, and we will. I'm just on these numbers constantly, pushing the system, and we'll get there. As sure as I'm here, we're on this.
Premier, by way of follow-up on testing, I've spoken to some epidemiologists over the past few days who have said that your government hasn't actually had a true COVID testing strategy, and that early on restrictive guidelines really entrenched views of people across the province about being able to get a test. And in effect, people think they can't get a test, so they are not even going to try.
Well,
Wondering how you would respond to those criticisms, and are you planning some sort of advertising campaign to convince Ontarians to go out and get tested for COVID-19?
Well, we are doing advertising campaign. You'll see that roll out, and even these hot areas, if I got to make robocalls to get people out, I will. We have a strategy. We're moving forward with that strategy to make sure we get as many people tested as possible. We encourage people, if you have symptoms, go to the assessment centers. A lot of assessment centers, I think we have 144, I believe, around the province. Go and get tested. We encourage it. No one's going to be refused. Please go there. I drive by one of the assessment centers into work every morning, and there's just no lineups. Please go out and get tested. It's absolutely critical. It's absolutely critical. Outside of going in there and getting people out of their homes and bringing them down, we need to pick up the advertising. 100%, we will pick up the advertising.
Last question.
Last question comes from Colin DeMello from CTV News. Please go ahead.
Hi, good afternoon, Premier. So I just wanted to ask you just on testing. So are you telling people now if they are asymptomatic? You have the platform here. A lot of people are watching. If you're asymptomatic, can you go into a COVID-19 testing center and get a test?
Well, we're asking people with symptoms to go into the assessment center. We are going to be testing the frontline healthcare workers this weekend, asymptomatic and symptomatic. But for now, the assessment centers, if you have symptoms, go in there. We are launching a program next week that will be going into areas, as I mentioned yesterday, everything from trucking associations to different sectors, automotive or processing plants. We're going to be going into those areas as well and testing everyone. But as for now, this weekend, the plan is we're going into senior centers, senior retirement homes, and testing staff and residents. We're going to follow up again with long-term care, frontline workers there, and all the healthcare workers as well. So we're going to be going hard all weekend. I'll be here. We're going to be following up to make sure this is happening.
Okay, thank you. And this weekend, a lot of people are potentially going to be going to a retail store across the province. This is a masking-related question. It's not mandatory right now. It's a recommendation. Should businesses have the ability to deny access to somebody who refuses to wear a mask?
Any business has the right to refuse anyone. That's their business. I highly, highly encourage that people put on a face shield. I know there's two big retailers, grocery retailers, that you won't get in without a face shield of some sort. It just protects everyone. It protects other people as well. So it's so important. If you have a face covering, please wear it. And that's the advice from our provincial chief medical officer, the federal chief medical officer. So please just wear a face shield when you can.
Thank you.
Thank you, everyone. Have a great weekend. Thank you.